thank everyone for joining us. It really demonstrates your commitment to this very important conversation. And next slide. Jenny, thank you for moderating today. I'll pass it over to you to introduce yourself and kick us off.
Thank you so much. I'm honored to be here.
I'm sorry, I'm just going to interrupt for a moment. I hear there's some problems with people not being able to hear the presentation. Is that still happening? Could I just get somebody from the chat to acknowledge that they cannot hear? So far I hear everything is good. So I don't hear anything different. Sorry for interrupting. I just wanted to confirm that, oh, people could hear now. That's good. Thank you so much.
Okay, thank you. So I am Jenny. My pronouns are she, her. I currently work in public health in the WRHA. I am a queer white settler, and my positionality to the trans community is adjacent. Recently, I've also had an opportunity to work at Clinic with a K's Gender Affirming Care program. And I'm excited to be here today with our panel of healthcare providers and researchers. We have Ashley Gaughan, Alba Lopez Gomez, Morgan Sterling, and Dr. Kelby Treloar. As you can see, we are recording the panel today. And at the end of the panel, we will have some time for questions from all of you, and we will stop recording for that. Participants have also been muted and cameras turned off at the moment just to help avoid disruptions. We will turn on the microphones for the Q&A, and we will share the PowerPoint slides after this event. So we will start a discussion in a few minutes, but first I'm going to share a little bit more about why we are here specifically today on this week. Next slide. So November 20th is Trans Day of Remembrance, which is an annual day that honors the lives of transgender, non-binary, and gender diverse people whose lives were lost in the last 12 months, many from acts of violence and discrimination. Events happen across Canada and internationally to mark this day, usually as vigils where the names of everyone who passed away worldwide are read out loud to honor them by name and acknowledge where they're from and often how they died. This week leading up to Trans Day of Remembrance is Transgender Awareness Week, which aims to increase awareness, visibility, and knowledge around transgender folks. And that's why we're here today, to take time as healthcare professionals and researchers to share information and actions that we can all take to decrease discrimination and strive to create safer spaces and provide more respectful and affirming healthcare, no matter what our role or professional title. And in our Manitoba and Canadian context, it is also important to recognize the Two-Spirit people community and Indigenous LGBTQIA+ community. The Missing and Murdered Indigenous Women and Girls National Inquiry emphasized the staggering rates of violence against Indigenous women, girls, and the 2S LGBTQIA+ people. Their calls to action for health services include specific interventions, such as recognizing that Indigenous peoples are the experts in caring for and healing themselves. Next slide. Today's panel discussion has been organized by Shared Health Learning and Sharing, and we all know that we have a shared responsibility to create safer healthcare environments, and yet sometimes the things that we may say or do are things that are counterproductive and forms of discrimination. We hope that today's discussion will support the ongoing development of a person-centered culture of care wherever you're working across Manitoba's health system. We also acknowledge that everyone is at a different place in their knowledge, awareness, and experience in this area. And today we invite you to sit with any feelings of discomfort and use this discomfort as an opportunity to unlearn, learn, and change. Language and research related to health outcomes for Two-Spirit trans and other gender diverse individuals continues to evolve. Next slide. And if you're a person who likes definitions and scripts, please have a look at the Shared Health Practice Guide for further information and links to resources. And additional resources will also be shared after this presentation. Next slide. Other resources that are available from Shared Health include these posters. They can be used in any area and are one step to creating a more welcoming space. But alone, they do not create respectful and inclusive environments, and they do need to be paired with actions and words. Next slide. And so without further ado, we will shift to our panel discussion, which will include questions about practice experiences, observations, and offer actions and future directions. So I would like to start by inviting our panelists to introduce themselves and share a few sentences about their work or background. And if we want, we could start with Ashley.
Hello, everyone. My name is Ashley Gaughan. I am the trans peer support worker at Clinic. I go by she, her, they, them pronouns. I'm a settler. I'm of white settler descent, obviously trans. What else do I do? Oh yeah, I'm almost done my psych degree at the U of W, doing a double major with women and gender studies. I guess that's about it for me.
Thanks so much.
Thanks.
Alba?
Good morning. My name is Alba Lopez Gomez. My pronouns are she, her. I am indigenous Nicaraguan descent, a social worker, intersectional feminist, educator, advocate, lesbian, and parent of 2 trans children. I have 16 years of experience facilitating a support group for parents with transgender and gender diverse children. We run the group out of Rainbow Resource Center. The group came about when one of my children came out, and 16 years ago, and we didn't have no doctors, nowhere to go. So with another parent, we found parents, family, friends of trans individuals. I do facilitate workshops about using inclusive language for different organizations. I'm also a community activist. And yeah, that's me. Thanks.
Morgan, would you like to go next?
Yeah, thank you. So my name is Morgan Sterling. I am a PhD student in community health sciences at the University of Manitoba. My area of focus is around gender diversity and data in cancer research. I identify as a queer, non-binary person. I'm of white settler descent, and have had most recently left working formally in the healthcare system, but spent the last 6 years working at Cancer Care Manitoba, working specifically around addressing inequities in the cancer care system.
And last but certainly not least, Dr. Kelby Treloar.
Hi, so my name's Kelby. I'm a family doctor out in Brandon. I use the pronoun she, her. I completed my family medicine training through the U of M, and I've been the physician at the Brandon Trans Health Clinic since 2018. I have a family practice at the Brandon Clinic, and I am also one of the physicians at the Brandon HIV Clinic.
Thank you all so much for being here. And so our first question to start off with would be, from your experiences, what is a practice that you have used or seen used that to make spaces or healthcare interactions safer, specifically for trans, two-spirit, non-binary, and other gender diverse folks? And you can all just jump in if you like.
Hi, I guess I'll start since I did the name thing first. Yeah, I guess, well, education, I guess, is key, right? Learning about the land that we have settled on, especially when it comes to truth and reconciliation, at least like going over the 94 calls to action. I mean, it's a tall order to work through that stuff. And of course, it can't be done alone, but educating yourself on those things is somewhat important. And seeking Indigenous two-spirit input into healthcare, I think, is very important, just to kind of depathologize a lot of the white settler kind of ideals and stuff around that, especially being trans. it's difficult for trans people to access healthcare, especially with like the perceived gatekeeping and things like that. And I'm sure I'll get into about how HRT is prescribed to cisgender people, and it's difficult for trans people to access that. But I digress with that. Yeah, more training, hire more trans people. That's it for me now.
Alba, you look like you want to go next.
Practice. I think what can we do is be mindful of pronouns, open the space when we go to people's houses, when we, because we're service providers, try to remember that we have a variety and extent different kind of people around us, and to be mindful of pronouns and open the space for them to feel safe. For me, that's one of the biggest things. Allow people to feel safe.
And I think, just to kind of like touch on what Ashley and Alba are saying, like, obviously, I think education is super important. Folks being able to use inclusive language, incredibly important. But it also is how healthcare providers kind of organize or orient themselves to the way they deliver care. So, using inclusive language in the intake is really important, asking about pronouns, thinking about how facilities are set up, so at Cancer Care, all the bathrooms are gender neutral, which is a wonderful thing to have access to for folks who are using those spaces. So I think, in addition to just, making sure folks have the knowledge, it's also about how spaces are organized to communicate, that safety and that inclusivity to folks.
Yeah, I would extend on that, Morgan. Like at our clinic, we haven't actually had to change our EMR or anything, but using its capabilities so that if someone has indicated a chosen name, chosen pronouns, that it's readily accessible for all staff members. So clients and patients, when they're coming in, aren't having to clarify that and feeling comfortable. And we didn't have to change our EMR, like technically. I think just using what you've already got can be really powerful.
Can you maybe expand on that a bit? And anyone can expand on that. Like, how are the ways that you have specifically seen those existing things like, existing electronic programs used to make sure that people are being, called by the right name and pronouns in interactions?
Like at our clinic, for example, we do need to leave often legal names, but putting in all capital letters, chosen names, so that when the chart is pulled up, it's very clearly stated. And then each client chart has like an alert, so we can put an alert, chosen pronouns, so that anytime that chart is being accessed, it's really readily available. Yeah, and we didn't have to change, like that's just, font size and using our existing system.
Something I forgot to mention is that I worked as a health care aide for 23 years at Misericordia. And something that we did when I worked in the sleep disorder center is we would create pop-ups for when you went into the individual's whatever. And yeah, so then it would pop up right away, so you could read it, because we all know that the way legal things go, you have to put it in a specific way. And the Akiro system at Misericordia was like, didn't have a lot of things that Clinic nicely has, where we have aliases, and then we'll also put in right beside their name their preferred pronouns and things like that.
And maybe I'll just add for context, like if people are wondering like why are people not just changing their names to like changing their legal names? You know, right now, since COVID, there are really long wait times with things, and I'm not sure if anyone has heard from people like how long they're waiting, but I think it's at least over like 8 months to even hear back from Vital Statistics. So there are a lot of delays for people that are wanting to legally change their name as well.
And not to mention there is a cost associated, which can be a barrier for a lot of folks.
There are little silver lining, I guess, in regard to ID. I'd heard from community members that you can walk into Vital Health or Vital Stats, and things will be done faster that way now that kind of COVID things have lessened. So, but then again, COVID's kind of ramping up. So get in strike while the iron's hot, right? So I guess in regard to that, also a good thing to be mindful of if you're talking to someone who's looking to change their name of Vital Stats is to get them to come to one of the ID clinics that are held at either Rainbow Resource, Sunshine House, or Clinic is holding them now. And there might be a bigger one happening at the U of W soon. But that's so to get like all your ducks in order, all your I's and Q's tailed and things like that, just to make sure everything's proper, because when you go to Vital Stats, or especially if you mail it in, they're not going to tell you if you did it wrong. So that's part of the reason why the wait list is so long. But so again, I would encourage people to go to one of those ID clinics and make sure everything's proper, and then go down to Vital Stats yourself and have everything done.
Is there anything else anyone would like to share about affirming or inclusive practices that you've used or seen used at this time?
There's something, I think it's Doctors Manitoba has an opportunity for healthcare providers to change, put their pronouns on their ID badges. So I'm not sure folks are super familiar with that, but I believe folks can go onto the Doctors Manitoba website and work out with them to get their pronouns on their ID badge. And I know that there was a question in the chat that I saw pop up about asking about pronouns, and somebody had said that they kind of model the pronouns, and having pronouns on badges, I think, is a good way to communicate, that you know that folks use different types of pronouns, and that you're open to having those conversations. So I just want to flag that.
Yeah, thanks, Morgan. I think that's a really good point, because it's sort of like an invitation. And that's, it's like a poster, but it adds to that by being an invitation. It's not forcing anybody to disclose any information, but only share what they would like to for that interaction. I think we'll move on to our next questions. So sometimes when people, like we probably all experienced when we're making changes to our practices, or how we speak to people, that we can face resistance from folks when we're using different language and such. Can you maybe talk about some of the barriers or resistance that you have faced in your work, and maybe even share a little bit about what could have been done differently, or what you would like people to do instead?
I guess I can talk to some of the barriers that I've experienced with individuals accessing care. I'm usually somewhat of a liaison or a resource kind of cultivator. And I get asked a lot of questions, especially because the wait list is so long with the Trans Health Clinic. It's about a year from when you phone to be put on the wait list to be just booked with the social worker. So it's like over a year before you can seek the care that you need. And I've gone over this before, but I'll just strike the nail a little bit more in regard to doctors learning more about how to prescribe HRT to trans individuals just because like clinic will hold the hands of physicians that are interested in learning through via eFax and things like that. But one of the barriers, I guess, within the whole healthcare system is a lack of an LMS or anything in regard to training or making awareness for trans care, period. So just kind of disseminating information is, I think, pivotal for physicians in breaking down that barrier for individuals seeking HR. It's like not difficult. Just people all the time. I don't understand. But again, I'm just part of that minority, right? And we have to advocate for ourselves, trans individuals. Yeah.
I would totally agree with you, Ashley. As being a physician, I think gender affirming care is primary care. There should be no kind of, like, as much as I love what I do, I don't need to be the only one. Like, I see all family docs prescribing it. And to be honest, it's no different than prescribing medications for blood pressure or diabetes with the monitoring and the dosing. Like, it's not, yeah, it's well within primary care. And that's definitely something that I preach. And whenever I talk to family docs, like, I think that would be a big step forward for our province if more and more primary care providers, nurse practitioners were doing that prescribing, because I really think that's what primary care providers are meant to do, for sure.
Yeah, I think this conversation also kind of like speaks about, you know, just the general discomfort that I think a lot of people experience with trying to, you know, or being in a situation where they are encountering or providing care to a gender diverse person. And, you know, if I think about some of the experiences that I've had, people refusing to use proper pronouns, saying that it, you know, if they're, or you know, not using gender neutral pronouns because it doesn't conform with like the English language or whatever. And you know, like the question in terms of like what you would want for people to do going forward around that, I think healthcare providers, you know, in the role that they provide, like there is kind of a bit of an advocacy bent to like providing care for folks, whether, you know, they think about it that way. And so I would really hope that folks working in the healthcare system can support one another and recognize that what they are ultimately trying to do is to create an environment that is safe and welcoming and provides people with the care that they need. And, you know, and I think also by doing that, it creates an environment where it no longer becomes permissible for people to opt out of providing care to gender diverse folks. It's, you know, what is the message that we're sending to folks? It's like, it's not okay to say, I'm not going to use they, them pronouns anymore. You know, like that is, you know, where I hope things kind of keep going.
I think confronting our own biases, right? We live in a cisgender binary world. And when we encounter, you know, trans people under the trans umbrella, that can bring some discomfort, like Morgan was saying. But at the same time, we are service providers. We have a job to do, and we want to deliver without dehumanizing that person, right? So we need to kind of check in where we're coming from and the kind of service we need to provide, because these are human beings and they deserve the respect like any other human being that you're going to encounter in your practice. So be mindful of your own and own it, right? If you need to do more readings, if you need to go somewhere, Rainbow Resource Center has a lot of things to offer and educate yourselves. Just literature, you know, there are workshops, there's like just confronting our own biases. Like I said, we live in a world that is cisgender and binary. But at the same time, we have a job to do. And we just have to keep in mind that we need to deliver services without dehumanizing people. So that will be the goal, to educate ourselves, because we have a responsibility as members of society, as service providers. We need to do a better job than we're doing right now. Inclusiveness.
I think along those lines, sorry to jump in again, but having strong policies that individual folks can kind of refer to say like, this is what we do and this is the expectation of the organization in terms of like how we deliver care to gender diverse folks as well as like other groups of people is really, really important. And having that kind of like institutional backing just helps kind of inform what are the expectations of service providers to deliver the care that they should be delivering.
I'd like to jump in there quick. Sorry, Jen.
No, please do.
Just on how important allyship is in regards to everything. Like something really important that comes to mind when I think of allyship is creating space for people. Creating space for people that differ from you, and especially in healthcare, we need to be able to do that, right? I don't have a lived experience as an old person yet, hopefully, but I have to make space for them, and like learn about those different aspects, because one day I will be that. But not saying that everybody's going to be trans, but it would be nice if more people would join us. Anyways. Yeah, allyship is important, especially like it's difficult for trans people to get their foot in the door if like there's a lot of gatekeeping just with colleagues, right? If someone is in power and can affect change, why not open the door for that?
I think that sometimes people can think that, using the correct or chosen name for a person or pronouns, maybe these seem like really simple actions, and they are, but we're not in a place yet where we're doing that, consistently in healthcare, and that's why we need to keep talking about them. And things like neutral language, so saying pregnant person is not excluding women or like cisgender women, but it's allowing that space for everybody. And this is what patient-centered care is to me, is really acknowledging who a person is. Yeah, I'm not sure if anybody else would like to share anything else about challenges in making changes or interactions with colleagues even, before we move on.
I just would like to say that, like, using the chosen name and the proper pronoun save lives. Like I can hear in my group, when parents come with teenagers especially, how triggering it is when they are, not seen and not respected with their names. It's triggering. They become suicidal. And I know that this is very sad to say, but it's a reality. It happens. So using the right name and the correct pronoun can save lives, especially for teenagers. Well, it will be for everybody, but it has a huge impact on people's lives. And sometimes, as being cisgender, we don't take that into consideration because we get what we need, but trans people don't. So just a reminder, like, to pay attention to those things that might seem very, like not that important, but for a trans person, it is really important to be seen and respected.
I think, Alva, like what it makes me think of is that people want to bring their whole selves when they are accessing care or going anywhere in the world. And when people have to kind of like cut out an important part of their identity, their wholeness doesn't get to be acknowledged and they don't get to be seen. And so, anybody, all the attendees here, like we all have multiple identities. We all have multiple components of who we are. Gender is one thing of who we are. And I would think that anybody on this panel, if they're in a position where they're needing to seek care, they would want to go to a place where they get to bring their whole self and have that wholeness like affirmed. And it's not any different for gender diverse folks. There's just different barriers that people that the system imposes on having that affirmed and acknowledged.
I'm loving all of the interaction in the chat. Thank you, everyone, for being so present with this. For our last question, before we go to questions from the audience, our final question for you all is, what is one thing that you would like to see leaders in systems like healthcare do?
I'll beat my dead horse again. So again, I would like to see like more learning systems like LMS, more workshops held by trans and queer people, disseminating information into various like lunch and learns and things like that, or just booking off various kind of things in regard to that. And again, seeking truth and reconciliation, going over those things, seeking input from Two-Spirit people. Two-Spirit Manitoba is a great place to go. Sunshine House, again, is another great place to seek those perspectives. Again, reading up on Standards of Care 8 that was just released by the WPATH, which I still haven't gone over just because I work in healthcare and I go to school and it's so busy. Fun community, include communities' voices in their own healthcare, and pay attention to studies done by trans and non-binary people, like somebody like Florence Paré, who is a University of Toronto student, bioethicist and activist. Like those kind of people should be brought more to the forefront and given more of a voice. Yes, thanks.
And, I think just to kind of like touch on the research side of it a little bit and reflect on the earlier conversation we were having about EMRs, one of the things that I think is a huge priority for our provincial health system is updating the way we collect information about patients. So making sure that we have appropriate ways of identifying gender diverse folks, being able to properly capture their gender identities, sexual orientation, different components of who somebody is. And part of that is because we don't currently collect information about gender identity in health records. There is a lack of research around gender diverse folks. So when we're thinking about system setting or system priority setting, we don't have the information about gender diverse folks' health outcomes, health experiences, to be able to compare that to the rest of the population and see where our health system can improve. I mean, we have lots of really good research that, does a good job of documenting where gender diverse folks have troubles, but we can't look at that kind of at a population level. And so I think that's a huge priority. I think that the leaders need to look at is how to improve, our overall health record system.
I think, and this is something that's hopefully coming and something I'm a part of, is incorporating gender affirming care and specifically prescribing HRT into all family medicine residency training programs, so that residents graduating from the U of M, going out into primary care, that will just be something that's in their repertoire, and so hopefully changing the conversation from it being more of a specialist model with myself out in Brandon and clinic in Winnipeg, to it being family docs everywhere. So I think that hopefully our university system and our health system can support that.
Yeah, more education, especially with the people that are coming out as doctors, nurses, people in healthcare. More education, having access to getting education, like in the computer, you know, like inviting people to classes, you know, the delivery of respectful services, access to healthcare, gender affirming care, real care, not just going to the trans clinic and waiting a year and a half to be seen, you know, and by doing that, we're gonna reduce, you know, suicide rate, you know, stress on families, you know, and on everybody, and the same health system as well. So it's just a lot of hope for people to also, you can become an ally by just educating yourself. You know, the trans community is a very, you know, young community, and it has a long way to go. And we all need to kind of pair up with them, you know, and help them get the access that they need to quality of care, you know, and funding and so many things. So jump in the wagon. We are all in this together.
Thank you all so much. I think that this has been really valuable, I hope, for people. I always enjoy hearing everyone speak. I think, Dr. Trela, you're the only person I haven't met yet in person, but enjoy hearing you all speak and share your information. Before we go on to the questions, is there anything, any knowledge or sharing that you would like to add or just, you know, share with folks?
Something I'd like to kind of draw attention to, and it might seem small, but I think it's relatively big, just especially around Trans Awareness Week, how we pay attention to like the morbid side of things, but I think we should be paying attention to the trans joy side of things as well, of how gender affirming care has bettered so many people's lives, saved so many lives, and built so many a stronger community. Yeah, that's all.
Thank you so much. So I think at this point, we will stop the official recording, and somebody magical will